right, I think we're live. Good afternoon, everyone. I am Alicia Reeves, author and entrepreneur, and I am thrilled to welcome you to today's live stream. It is a special pleasure for me to introduce someone and to have a chat with someone who is not only truly remarkable professionally, but also my dear friend of 24 years, Dr. Wendy Garvin Mayo. Today, we're going to delve into Dr. Garvin Mayo's extensive expertise. We're going to explore her innovative approaches that her organizations are pioneering. And we're going to gain an insight into her visionary approaches to stress management, as well as mental health well-being. So without further ado, Dr. Garvin Mayo, it's good to see you. Welcome.
Thank you so much, Lish, for agreeing to do this. This has been something that our audience has been asking for. Many people think they know me from social media, but this is an opportunity for them to truly get to know who I am and really my vision for collaborative cancer care.
Yeah, let's get right in. Getting to know you is getting to know the many hats that you wear, the many titles that you have. There's so many of them. But right now, let's talk about you being the founder and CEO of Collaborative Cancer Care, a mental health practice curated to provide services to cancer patients, cancer survivors, their families, as well as healthcare professionals. Wow. So what I'm hoping today is that you can share with us what motivated you to found Collaborative Cancer Care, and why is it so important to address the mental health needs of those affected by cancer?
Yeah, so I have been in the healthcare industry for over 20 years. I am an advanced practice nurse practitioner. I spent most of my career in cancer, caring for cancer patients and their caregivers and families. And throughout my career in the clinical setting, in leadership, in the pharmaceutical industry, mental health is something that there's a gap. It's something we don't really address, even though we know that a cancer diagnosis can be so devastating to the patient and their families. So I have always wanted to, how can we address that? I always wanted to do something, start an initiative. To be totally transparent, I never thought I had it. I never thought I had the credentials. I never thought I had the business acumen to actually do it, even though I knew it was a problem. When I was in clinical practice, I tried to partner with a social worker to come in and see our patients. That really didn't work, but we didn't have anyone in our practice who can really address this. So many times we, as the nurses and healthcare professionals, become that person. And collaborative cancer care was really born this year in 2024. However, it's been a thought that I put down on paper in 2016, I believe. When I did my doctorate program, I wrote a business plan for the Sunflower Center. And
Yes.
this business plan allowed me to really envision what I thought mental health in oncology would look like. So I wrote this whole business plan that's actually published in the Nursing Economics Journal. So I wrote that, put it aside. And then in 2024, I really had the courage, had the business acumen, had the confidence in the partnerships to start collaborative cancer care. And that really stemmed from 2020. That's where everything was really born. In 2020, when the pandemic started, I just had my son, your godson. I was home working as a scientist for a pharmaceutical industry. And, in retrospect, I always say I was wrestling with my purpose. I wanted to serve. How can I do more? Even though there was a virus out there killing people, I wanted to go serve my cancer patients. So I made the hard decision of going back to the clinical setting. And in doing that, I was able to identify stress, burnout in healthcare professionals. I also looked at the caregivers. So I started a first organization called Shape Partners, right? Which was really to address that. And then born out of that was the Stress Blueprint, which is still my company where I focus on stress management. Starting those two endeavors gave me the foundation to start collaborative cancer care. So I received coaching, I received different mentors who really helped me build those businesses. And I was able to utilize that knowledge to start collaborative cancer care.
Wendy, you've given us so much information, so much. You have over 2 decades of healthcare, in the healthcare field. You have a proven commitment to enhancing oncology patient care nationwide. Nationally, you are moving to provide that. So you've touched on the stress blueprint. We're going to get to that in just 1 second. But one thing I want you to let us know is that your tagline for collaborative cancer care is that you are going to revolutionize cancer care. Let us know in what ways is collaborative cancer care addressing the unique mental and emotional needs of cancer patients, survivors, their families, and healthcare providers.
Yeah. So I tell people join the revolution.
Yeah.
So revolutionizing mental health in oncology is really making mental health a priority for every patient, caregiver, survivor, family member who is impacted by cancer. So that's
Mm-hmm.
the revolution. In collaborative cancer care, we are right now partnering with many healthcare organizations here in Connecticut, where they are referring patients time of diagnosis, time of progression, or even in survivorship. So I want to see that across the nation, across the globe. Every cancer patient, every family should have some sort of mental health partner, I would say. And it's not
Mm-hmm.
necessarily counseling. It doesn't mean they're crazy. Cancer is devastating. So the
Yes.
revolution is that every patient, every caregiver, every family member will have someone like me or, my staff to really join them on their journey. And here at Collaborative Cancer Care, what makes us different is, yes, we provide therapy, we provide counseling, medication management if they need it, but we also provide education, advocacy. We provide them clarity. Because sometimes that
Mm-hmm.
uncertainty is what's causing the angst, right?
Yes.
So that's the revolution.
And I think we all want to join it, and it's because cancer affects so many lives, and it's so many of the pieces that you've mentioned, the advocacy, and it's the not realizing you're stressed out. It's the not realizing that it's so many things that collaborative cancer care offers that those of us who have experienced loss with cancer or are experiencing the cancer fight don't know that we need. And you're offering it to us. Now, something that you did touch on with you touched on many of your other hats, but one of them that I want to look into and share with our audience is that you mentioned your stress blueprint. And your title within the stress blueprint is the Stress Solutions Strategist. Tell us more about that.
Yeah, so I am the stress solution strategist, and I have a very unique gift of helping people navigate stress. In our country, in our world, stress is inevitable. However, stress can be detrimental to our mental and physical health. So I help people really navigate that. And, the Stress Blueprint is that. We are the number one stress management coach and consulting firm in the nation. And I'm able to take that knowledge, take those frameworks, and actually leverage it here at Collaborative Cancer Care for our cancer patients. Because as we know, stress is the precursor to anxiety, depression, substance abuse, insomnia,
Yes.
all of those mental health issues. So that is the Stress Blueprint. I own it. I have that gift. I have a proven record of helping people
Yes.
through one of the most stressful times of their lives, which is cancer.
So you have intertwined two of your passions. Your passion for supporting those who are going through for cancer caregiving, as well as your fellow healthcare professionals manage that stress that I'm sure that all too well, within that industry. So I'm hoping that you could let us know, just for our audience, what are some of the common stressors faced by professionals, and how would the stress blueprint support them to address those problems?
Yeah, so healthcare professionals are facing many challenges. One big one that everyone's talking about is the shortage. There's a healthcare shortage that's really impacting healthcare, especially our nursing shortage. That is a crisis in the United States right now. Another is, insurance companies. Are we able to provide the most valuable care to our patients. Right now, insurance companies kind of dictate what we can and what we can't do. So can we truly practice the way we want to do that? And also personal. So, many times we are working in healthcare settings, especially in an oncology setting, where we are dealing with life and death on a daily basis. That weighs on us, right? We are individuals who have families who come to work to do this, work, with caring for patients, but we're bringing a lot with us. So understanding that. And one of the reasons that, the stress blueprint is so important, how it relates to collaborative cancer care, because for our cancer patients and caregivers, if our healthcare professionals are not well, they cannot effectively take care of our patients.
Mhm.
So that's why the stress blueprint is essential. And that's why collaborative cancer care is essential. So
Mhm.
it is a nice partnership. And at the end of the day, the bottom line is that we want patients to receive the best quality care that they can.
And what you're also doing is by giving these patients an opportunity to receive the best care, you're helping their caregivers to show up as whole individuals, to be there for their patients. And you really can't beat that. And it's really just such valuable work that you're doing here. What future goals do you have for both collaborative cancer care and the stress blueprint?
Yeah, so collaborative cancer care, my goal or my vision for it is that it's going to be revolutionized. That
Mhm.
patients who have a cancer diagnosis receive a mental health partner. We talk about the psychosocial impacts, and I think when you say
Yes.
mental health, people are like, people kind of shy away from that.
Yeah.
But
Yeah.
cancer is devastating. It impacts every part of your life, and we know that if patients have anxiety, depression, adjustments disorder, whatever it is, if their mental health is not intact, it's going to impact their survival. It's going to impact their treatment decisions. So
Yes.
I really envision that everywhere, not just in Connecticut, that every individual have a care partner or have someone they can partner with. And it's not that healthcare professionals don't want to provide that. There's
Mhm.
not a lot of us around. I haven't found any independent practice who is just doing oncology, who's servicing oncology patients in their mental health. And if you call right now, I have done it right before I started collaborative cancer care, that market
Mhm.
analysis. You call around, you're talking to a voicemail. You're not talking to anyone. No one's calling you back. Or if they call you back, they can't see you for 6 weeks. I need to be seen now. And that's what we pride ourselves on. We pride ourselves on convenient and compassionate care. If you call us today, you're going to talk to someone today. You're going to have an appointment within 1 to 2 weeks.
Yeah.
So it's really important that providers have the resources, have the partnerships to provide that care. And my other vision for collaborative cancer care is that we are looking for community partners, across the nation. How can we help you really build this infrastructure in your organization? How can we help you educate your staff on how to assess patients, how to refer patients, help you find referrals, really build that infrastructure for you? How can we maybe be a resource for your patients? Right.
Mhm.
So we provide
Yeah.
health, we take
Yes.
insurance, but I mean, we also, have an arm where we do the advocacy, where we can be that for you. So we
Wow.
are looking to partner with organizations, with individuals, with advocacy groups, anyone who wants to join the revolution.
Yes, absolutely. And you touched on so many things. One of them being the urgency being now for that patient and their family member and that caregiver, as well as decision making. I
Mhm.
don't think that that's something that people take into consideration, that I need to be my best self so that I can make the appropriate decisions. And understanding that collaborative cancer care, the compassion that you'll offer into just helping someone to not only make those decisions, but to advocate for themselves. It is major, it is major, and this is valuable work. And I hope that those listenings will be able to reach out and send this message to someone else. And so before I have my last question, I have one more question for you. What message or advice would you give to individuals who are currently right now struggling with the stress of a family member, a loved one who just doesn't know which way is up? They're dealing with this cancer diagnosis and they don't know where to turn. What advice would you give them, and what the next best step would be to take?
Yep. The next best step is to go to your provider and say that you need help. It's really saying, I need help. And if you're not getting any answers, you go to collaborativecancercare.com and you schedule a consultation with me, and you and I will help navigate that together. But it's really asking for it. Many times we wait for our providers to offer it. They're short on time. They're short on staff. They may not be offering it. Does not mean that you should not receive it. So that's where the advocacy come in, is knowing that you need help and saying, I need help. Is there someone you can refer me to? Is
Mhm.
there someone here in your organization, or is there someone external that you can refer me to? So that is what I would say. And this is for our family members. This is for our caregivers. And I want to just say something about family members. When I say family members, I'm saying you can be living in, Washington, D.C., and you have a person in your family, an uncle, mother, cousin, who was diagnosed in California. You are a family member, right? So
Absolutely.
we're
Absolutely.
still people. I think about, I'm not in the house with that person. I'm not there,
Mhm.
but it's still impacting you mentally.
Absolutely. Cancer is affecting our loved ones near and far, near and far. Mhm. It is.
Absolutely.
Thank you for that. And so, Wendy, you talked about collaborativecancercare.com. How else can we join the revolution? How do we find you? How do we find Collaborative Cancer Care? How do we join you?
Yep. So you can go to collaborativecancercare.com. You can schedule a consultation. We can actually have a conversation, or you can email us at info@collaborativecancercare.com, or you can, look us up on YouTube. We have a nice resource there where you can kind of tap it and utilize that as a resource for your patients, your survivors, the people in your ecosystem. But yeah, I would say you can even call. You can go on the website and you can call, right? Easy
Right,
access.
right. Someone
Access.
will answer.
Someone will answer. Yes.
Yes, yes. This has been a valuable, valuable conversation. Dr. Garvin Mayo, thank you for that. And I will personally thank you for the support you gave me when my family was dealing with our cancer. My dear grandmother passed away, but during that fight, I could not have done it without you. And so here again, and I will continue to thank you for that support that you gave me during that time in my life. And I look forward to all of the other lives that you will touch with both the Stress Blueprint as well as the Collaborative Cancer Care. I'm very excited for this.
Thank you so much, Lish. I really appreciate you conducting this Meet the CEO interview.
Anytime, when. Thank you.